So today's lecture, or this month's lecture, I should say, is about child development and unlocking your child's potential. Now, when I started to write this lecture, I had lofty goals and I thought I'd be able to put in a lot more than I did, but it started getting way too big, so I had to cut it down. So some of the stuff we'll talk about at the end that we probably will not get to, but don't worry, I have a plan. All right, so let's get into it. It's called Unlocking Your Child's Potential. Every child deserves a chance at a great life. And we're going to be diving into a little bit about child development. Who am I? For those of you who don't know, my name is Dr. Scott Jahn. I am the founder of Form and Function Corrective Chiropractic, along with my wife, who's the technical officer, I guess. And a little bit about me. I am from New York originally. I went to Manhattan College, my undergrad in sports medicine. And then I went to Southern California University of Health Science to study chiropractic. I also have advanced certifications in golf injury and performance, in applied kinesiology, strength and conditioning specialist through the NSCA, I'm sorry, and some other certifications like nutritional seminars, things like that. We don't need to go into too much. So let's talk about neurodevelopment, right? When we are discussing children, really, why is neurodevelopment what we discuss? And that's because what is the master control system of the body, right? Anybody know? Just kidding. The master control system of the body is our nervous system, right? Our brain and our spinal cord controls every cell, every organ, every muscle, controls how well we heal. And it all starts at the formative years. Primarily, the main window is from 0 to 6, but we'll see it starts to taper off, but still anytime in a child's life, we are developing new synapses and new neural connections that will follow the child for the rest of their life. So neural development, right? So humans have at birth the potential for intelligence that it really is beyond measure. It's astounding of how much potential is there. And unfortunately, as humans, that we really don't appreciate and access it. Really, our potential that we actually wind up with more times than not is just due to accidental circumstance. And that's not to say that that we don't have good intentions or we don't want the best possible life for our children. It's just nobody's taught us, right? So we don't know, right? We love our kids and we support them, but nobody's actually told us how to actually kind of raise geniuses, raise superhumans, and that all starts with neural development. So the brain depends on outside stimuli, right, to facilitate the process involved in growth, right? These are our senses, right? Now, movement is primarily the first one that we always do is critical, right? Without it, the brain and the behaviors that it controls, they won't grow, right? So we need movement. It's essential to our brain development. We can literally grow the brain by giving the child a rich visual, auditory, tactile, olfactory, and gustatory, which is taste, information, which increases frequency, intensity, and duration. So when we're designing a program for a kid, at least in my clinic, right, some kind of neurodevelopment program, whether the kid is atypical or they're hitting all their milestones, or maybe they have some kind of a functional deficit of one side of the brain or the other, which we'll discuss in a little bit. Everything revolves around sensory stimulus, right? The brain, it's kind of like exercise for the brain through sensation, and movement is primarily how we do that. But we also add, right, smells and eye cues and eye exercises and things like that, all to stimulate neurological response. So the pathways by which we gain all information is through our senses. Okay, we use them and they'll grow. and become more mature and competent. If we don't use them, it's kind of a use it or lose it sort of thing. They just won't develop into a proper pathways. So when you improve one function of the brain, luckily for us, all parts of the brain will increase to some degree depending on location. Usually the parts that are really adjacent to what we're stimulating. So if we're stimulating vision is located usually in the back of the head. It'll stimulate centers that are adjacent to that, and same thing with olfactory and other things of that nature. Okay, so the results of making sure that we have proper stimulation and kids have neurological development that is above and beyond normal is we get kids that are more curious, they're more independent, they're capable of taking care of themselves, they're more confident, self-assured, and they're more conscious of their own self-worth, and they have highly developed personalities, right? This is all characteristics of neurologically strong children, right? Usually when we don't get the neurological development, we'll see kids don't make eye contact, they can't read facial cues of other people, so they can't make strong connections, right? They're usually auto-stimulation to try and get more neurological input, right? So it's really important that we try and stimulate the brain as best we can. So there are 7 areas of brain growth. Now, I should kind of point out, I was going to point this out in the beginning, that all the stuff I'm presenting is, I'm really, obviously, I'm not a researcher, so this is all stuff that I've learned. I'm basically standing on the shoulder of giants, so I just kind of want to give a little shout out to them. They would be such innovators as Glenn Doman, who is a physical therapist out of Pennsylvania. Also, Robert Malillo played a huge part in me putting this together. He runs brain balance centers and does a lot of amazing work with neurological development of kids with that you'll see. We'll discuss some of his work later, but with functional stimulation of right brain, left brain. Also, Ted Carrick, who's another Dr. Ted Carrick, who does chiropractic neurology. And then there is Patrick Nemechek, who we'll be discussing when we talk about nutritional protocols. So I just wanted to acknowledge those guys. There's probably some others that I'm forgetting, but if anybody wants more information, more in-depth information, look to those guys because they're really true icons in the field of child development. Okay, so back to our story, right? So 7 areas of brain growth, right? We have motor control, right? And this is our primary way that we can get muscle stimulation, primarily because the muscle control, especially postural muscles, they never turn off, right? So we can utilize that in sending signal to the brain. Research has been done that shows the actual brain will atrophy in the gray matter, which is the processing part of the brain. It'll actually atrophy if we don't get enough stimulation from joint receptors going to the brain, which is why it's so important. And we'll discuss how we do that in a bit, right? So muscle tone, coordination, strength, right? These are all part of the motor control system. And intelligence is based on proper development of muscles, right? It'll develop the frontal lobe, as we just talked about with the gray matter. Then we have sensory, right? Correlating the 5 senses of touch, smell, taste, vision, and hearing. We have emotional, which is the ability to control and display emotions at appropriate times. Behavioral, acting appropriately in social circumstances. Academic, being the ability required for learning and retention. Immune function, right? Tendency towards allergies and chronic illnesses. We'll see usually when we have a right brain or left brain deficit, we'll either have autoimmune system where the brain doesn't have a braking system, or we'll have an immune system that just is underactive, and kids will get sick a lot of times, and we can manipulate that with certain motor function and other sensory cues. And then we have the autonomics, right? Self-regulating of body function, right? Our organ functions. So our synaptic connections are the key to our brain development, right? Our synaptic connections happen when we move, right? So they're dependent on two things, right? Fuel, which is in the form of glucose and oxygen, okay? And then stimulation. So this is why things like exercise, things like chiropractic adjustment are so vital, and also they're just so effective because they cover 2 out of the 3. You get stimulation from muscle motion and from joint receptors sending signal to the brain. And you also get oxygen, right? The more you move, the more the body gets oxygen because the receptors can carry oxygen more in the blood. And we get more oxygen, right? When we're stagnant, when we're sitting still and not doing much, we don't get much oxygen going in the system, right? This is why when a kid's on a smartphone or watching TV or playing a video game all day long, right, their oxygen levels drop and they really don't get much brain stimulation. Okay, so the outside source of our natural environmental stimuli on which the brain depends are light, sound, vibration, odor, taste, temperature, touch, pressure, and gravity. So whenever we're designing a program for neurological development, whether it be, again, a typical or atypical child, right, we're going to use these, and we can design rehab programs based on stimulation of one or more of these senses, right? We can use strong senses like a garlic or coffee or cinnamon, right, to stimulate our olfactory sense. We can put a patch over one eye, right, to make sure that vision's only coming in one part of the brain, right, that's lagging behind. We can use vibration plates, which we'll discuss in a bit, right, which will cover gravity and exercise. So many different ways we can do it. We're only limited by our creativity. So the more a brain cell is stimulated, the more will increase in size and the processing of speed and strength of its connections, and will form new synapses. Right? Success is based on 3 factors, and that's frequency, repeated muscle activation, and proprioception. Right? So more frequency than time. Right? If you only have 15 minutes, it's better to do it for 5 minutes 3 times a day than for 15 minutes once a day, so we can get that increased stimulation. The duration of the stimulation, the intensity of stimulation is also a factor. Now, when we talk about repeated muscle activation, we said it's the single most important element for brain development. Again, more time, right? Less actual duration, I'll say, and more frequency. And 1 minute, 15 times a day, much, much better than 1 time a day, 15 minutes. And then our proprioception, right? That's where our movement comes in, right? And I'm partial to things like chiropractic adjustment because I am a chiropractor, but also because it does so much for our proprioception and our joint receptors, right? Our spine is the generator for our brain. And when our spine is not moving properly or moving inappropriately, we don't get that signal to the brain, and then we don't get proper brain development. So I want to point out a research that kind of highlights that, and it's a research that was done at Berkeley, and they studied 2 sets of rats. So one set of rats lived in an environment that was it wasn't too much sensory ability, like a lot of sensory deprivation, right? Not much to look at, not much to hear, not much to feel. And then the other rats were raised in an environment that was sensory rich. And then they tested the intelligence on the rats by using a maze and finding food. And what they found was that the deprived rats, either they couldn't find the food or it took a long, long time for them to find the food, while the rats that were in enriched environments found the food very easily. And the head researcher, he noted that rats, which have been raised in sensory deprivation, have small, stupid, underdeveloped brains, while the other rats raised in sensory enriched environments were large, intelligent, and highly developed brains, right? So this just kind of goes to reinforce my point of even if your child is not an atypical child and is developing normally, a neurologically based program, right? And it doesn't have to be something that's not fun, right? We use it, we try to develop these as games, but a neurologically developed program to stimulate new neurosynapses will make your child so much smarter, so much more engaging, so much more EQ, IQ, right? That they'll be way ahead of the game. And we were going to touch on that. You can actually teach a baby as young as 2 years old to actually read, right? Do math, to read, and to know certain facts like history and things of that nature. So what's our problem? Well, today's children, they are hard to control. They show less respect for authority figures. They have less physical activity. They have shorter attention spans, get poorer grades, generally unmotivated, and poor diets, and they don't exercise, all because they're addicted to their computers, cell phones, iPad. Technology is great, but it's really put our youth in a bad spot where they're just not moving, right? And no movement, no stimulation to brain. The brain just does not develop, okay? Compound that with the fact that usually kids are the product of a 2-income family. So not a lot of time to sit and cook a long, nutritious meal. So we're eating out a lot, or we're ordering in a lot, which comes with a lot of problems as far as diet, which we'll talk about when we get to that point. So with chiropractic, right, the only source of constant stimulation to the brain comes from the spine and its postural muscles that are constantly adjusting to the force of gravity, even when we're laying down, right? This is a system that never turns off. So if we don't have a proper spinal alignment, what we call subluxations, which just means the bones are not sitting where they're supposed to be. We have poor biomechanics. We have poor stimulation to the brain, so the brain doesn't develop as it should. This is why chiropractic is so important for children, because if we want proper brain development, we have to have the spine moving properly. All right. Chiropractic care can be beneficial for children with neurodevelopmental disorders as well, okay, by stimulating and regulating the nervous system with adjustments. Right? Discovering if there is a delay in motor or sensory nervous system development, and through play therapy, like we discussed earlier, and rebuilding those neural pathways by constantly stimulating the brain, by keeping the spine aligned, and also with our home rehabilitation programs. Okay. Chiropractic adjustments remove sensory processing issues due to the lack of neurosensory integration of biomechanics and joint receptors to the brain. Okay. In addition, whole body vibration is a wonderful adjunct, right? Because it will stimulate postural muscles, also stimulate your vestibular response, which is where it's part of the brain that lets us know where we are in space, okay? Which will help with posture and help with neurological development. What do whole body vibration do? Well, it strengthens muscles with tone and endurance. It helps blood and lymph circulation, so we get more oxygen throughout the body, decreases inflammation, pain, mobilizes joints, reduces stress, regenerates tissue, decreases scar tissue. For us older folks, it prevents osteoporosis, improves posture and balance, and improves proprioception and neuromuscular reeducation. That's the part that really is where child neurodevelopment comes from. We want to increase that proprioception. And when we're on a vibration plate, we are getting 60, 100 contractions a minute or a second, I think it is, per second, right? So it's incredibly fast, and there's no other therapy or stimulation that you can match as far as getting that kind of neurological stimulation to the brain. So you get hyperstimulation in such a short amount of time that we really get some really good development of our brain function. Also increased growth hormone and improved overall function. All right, so it's a little hard to read, so I'm just going to read it out to you, because it gets confusing. So whole body vibration decreases levels of cortisol, right? Cortisol is the stress hormone, right, which can be detrimental. Okay, right there, referred to as stress hormone. Cortisol increases the buildup of fatty tissues in the body, and catabolizes, which means it breaks down muscle mass into free amino acids and increase the levels of blood sugar. Whole body vibration therapy increases levels of human growth hormone by 361%, right? This hormone accelerates the anabolism, like the synthesis of proteins, by stimulating growth and regeneration, and breaks down the fatty acids. okay, providing a boost in energy levels, commonly referred to as the anti-aging hormone. Additionally, whole body vibration therapy also has been shown to increase the levels of testosterone, which plays a key role in the health and well-being, both male and female, by enhancing libido, energy, immune function, protecting against osteoporosis. Also increases muscle mass, strength, as well as bone density and strength. Testosterone levels decline gradually as we age, which may be cause for infertility, decreased libido, erectile dysfunction, osteoporosis, loss of appetite, and anemia, right? But as we're discussing it with children, right, what we're really after with whole body vibration is that neurological stimulation, the barrage of information, right, of that signal going to the brain, which increases our neural synapses. So just standing on it will cause the body's postural muscles to contract anywhere from 30 to 50 times per second, depending on the frequency. Okay, so in just 8 to 10 minutes, a person can get a complete full body workout. The muscles get tremendous workout, resulting in increased strength, stability, and tone. Blood flow increases throughout the body. Joints become stronger, yet more flexible. And the levels of stress hormones like cortisol decrease, while levels of other hormones, such as growth hormones, testosterone, which are important for regeneration and repair of processes, actually increase. So tremendous amount of benefits from using whole body vibration, right? Again, far more than we can do in any other type of venue, whether it's home or somewhere else. So we have 5 critical stages of neural development. Now, this is important because a lot of times if a kid is developing, they can get stuck in a stage. Right. And let's go over this first and we'll discuss it. Okay. So the first stage begins at birth. And this is the movement without mobility, right? This is a baby that can just flail away, but there's no real purpose to it. Right. And then the second stage, we call it crawling, when a baby can be on the stomach and can actually move. They're not yet on hands and knees, but they're on their belly and they can kind of scoot. Then our third phase, which is called creeping, and that's typically where most people would think of as crawling, right? These were developed by Glenn Dolman, right? So he calls it creeping. I tend to think of it more as crawling, but I'm going to, out of respect for him, keep his terminology. The next significant stage occurs when the baby can get up into a bipedal position and start walking, and then finally they start to run. Now, these are important because during each of these stages, the brain has to develop. And sometimes what happens is a child can skip a stage, not spend enough time in a stage. And what happens is the brain doesn't develop and kind of gets stuck. We're talking right brain, left brain activity. They just won't develop because either a baby's been stuck in one of those seated walkers and they didn't have enough time to be on the floor and crawl, and then they just don't develop the same. So we call this functional disconnection syndrome, and this is the work of Dr. Robert Melillo. Okay, so the areas of the brain, especially the 2 hemispheres, right, the right and left, they're not electrically balanced or synchronized. Right? Usually one will start to develop and then it'll slow down, and the other one will start to develop and it'll slow down and it'll go back and forth. And we can get stuck in any one of these stages where one just didn't develop because of an insult of some fashion, which we'll discuss in a slide or two. Okay, so this electrical imbalance interferes with the ability of the 2 hemispheres to share and integrate information, meaning the brain can't function as a whole. And they include sensory, motor, cognitive, academic, emotional, and immune challenges. A functional disconnection is essentially a communication breakdown between 2 hemispheres of the brain and areas within them caused by developmental delay in one or both sides of the brain. So how do we get neurodevelopmental delay? Well, we already discussed a little bit of it by skipping or not spending enough time in any one stage, right? A baby that is not allowed to be on the floor because of whatever reason doesn't get that neurological development to move to the next stage. toxins in the air and water, right? Sensitivity to heavy metals, increased cesarean births and other birth traumas, right? When a baby's being born, if it's a cesarean birth, they're always going to get a traction to their neck, and a baby cannot handle traction to the neck. So we always have birth trauma with any cesarean. So the World Health Organization made a statement on cesareans, said something, I think it was to the tune of 80-something% of cesareans were unnecessary, right? But they're commonplace now. I know where I live in the Philippines, more than half of babies are delivered by cesarean. And so what are we doing to our children, right? We have to extract them either through a vacuum extractor or forceps, and we're causing a traction to the neck, which causes damage and a problem to the neurology. One of the reasons why we're getting increased amount of cesareans is because the mother has pelvic distortions, which causes too much stress on the uterus. And then we get what's called a breech, where the baby can't turn because there's too much stress, right? The ligaments on the uterus are causing tension, so there's not enough room for baby to turn. And if that is the case, right, chiropractic is wonderful at helping that. There's something called the Webster technique, which focuses around that. There's a ligament called the round ligament that we focus on, and balancing the pelvis, which will then take pressure off of the uterus, and the baby can turn and move around, right? Also, when we think of pregnancy, chiropractic is wonderful for pregnancy because, right, think of all the things we're discussing now. We're discussing how movement improves neurological function, right? Now, that just doesn't happen once we're outside of the womb. In the womb, it happens as well. But baby is allowed to freely move around in the womb. They're going to develop much, much better, right? And they can't develop in the womb if our pelvis is twisted because we've been sitting too long. Women get a hormone called relaxin that helps expand so that things don't tear as the baby's developing. And that causes shifting in pelvis, plus the center of gravity pulls forward as the baby develops. So it's very common for our pelvis to be shifted out of proper position, right? Again, we call that a subluxation, and that puts stress on the uterus, which doesn't allow baby to move so much. You can see it's amazing as whenever I get a pregnant woman on my table and we start to take pressure off of the uterus, the baby just starts kicking like crazy, and we can start to feel the movement, right? From the baby now being able to move around. And what does that do? Again, it's allowing neurological development, because movement is life and movement creates neurological development. So what else do we have? We have vitamin D deficiency, right? We're using too much sunscreen. We're not going outside so much. So vitamin D deficiency can cause a neurological delay. Sedentary lifestyles, we already kind of talked about that through sitting a text neck and sitting and using our electronic devices. Obesity through bad eating habits, stress, right? And from older men and women now are conceiving, especially a first-time child, we get neurological developmental delays in that as well. Now, these are just a few. There's an endless supply of ways that we can get either, again, to quote Malillo, a functional problem, or to quote Dolman, who talks about, he considers it a brain injury, right? Meaning that the brain isn't allowed to develop. Not that there's a physical trauma to the brain, but it's just a brain injury that needs to be dealt with. But we're basically talking about the same thing. So brain has two different sides, right? A right side and a left side. Right? Our left side is considered more logical, more analytical, and our right side is considered more creative, more intuitive. And we can see traits when one side is lagging over the other. So brain function of left side is really small picture, right? Serial processing, verbal communication, fine motor skills, IQ, reading words, math calculations, planning. These are all left brain activities. Whereas right brain is a little bit more big picture, more parallel processing, nonverbal communication, large muscle movements, reading comprehension, right? Main ideas, things like that. Math reasoning, word problems, and actually doing things. So again, if we see one area is lagging, we want to start to develop a neurological program around activities that enhance that lagging part of the brain. Okay, emotions that are associated with each part. The left brain is happy, anger, and surprise, while the right half is more of an avoidance type of activities like sad, fear, and disgust. So signs of a right brain deficiency would be your autoimmune disorders, right? Because there's the right side is the brakes, right? The left side we're going to see is more of getting sick, and then the right side is the immune system goes on hyperdrive and doesn't slow down. So we get autoimmune disorders such as allergies, asthma. So if your child's suffering from a lot of allergies and asthma, right, it might be that they're suffering for a little bit of a right brain deficiency, and we might want to integrate a neurological program to stimulate right brain, right, just to bring that up and to get the immune system functioning properly again. So we get immune problems, we get internal inflammation in the body, in the brain, poor digestion, get rapid heart rate, we get late or delayed speech, hyperactivity or impulsiveness, we get oversensitivity or undersensitivity to the world around them. Usually they're very fussy eaters. Okay. They trip and fall a lot. Their proprioception is not really where it should be. You get poor muscle tone, especially in the large postural muscles. Right? Again, why vibration therapy is so beneficial. And they tend to act out, right? They have meltdowns, right? They get impulsive, they get disruptive, all because they're trying to stimulate. On the opposite side, our left brain deficiency, we get patients or children that are appearing shy and withdrawn. They're prone to chronic infections, right? Because their immune system is not active. Whereas a right brain deficiency, they're overactive, left brain, they're underactive. So you'll see a lot of ear infections, colds, things like that. So if that's going on with your child, right, we might wonder, maybe we need to look at some left brain issues, right? We need to get some proprioception going on the left side or the right side of the body, which will stimulate the left brain. Abnormal or irregular heartbeat, right, called arrhythmias. They prefer solo activities, right? Dyslexia is classic left brain. They don't seem to have much motivation as far as school, right? It can appear that they're lazy. Their language skills are not up to par. They have a problem with reading and spelling, and often they're very concerned about how they look and are acutely aware of how other kids are looking at them. Okay, so symptoms would include that they don't feel like they're in their own bodies, right? Their proprioception is not such that they're comfortable in their bodies. They have poor abnormal muscle tone. Eye movements is a big one that we work with to make sure we can stimulate brain through tracking eyes and whatnot, which will stimulate the vestibular system. They're disconnected from their senses. They become easily distracted. They're socially and emotionally disconnected. They get sick a lot because their immune system's out of kilter, right? Most of them are picky eaters, as we discussed earlier, right? Children who can't feel their own body movements, cannot intuit their connections between movement and feeling. They can't interpret facial expressions and tone of other people. Social and emotional disconnection from others makes it hard to build relationships. They often have mixed dominance, right? You'll see like if they write with their right hand but kick a ball with their left hand, if their one right eye is dominant but their left ear, right? So you can do little tests with your kid to see if they should all be right dominant or left dominant. It doesn't matter if it's right or left, but they should stay consistent one side versus the other. So you can throw them a ball, right? Say, hey, catch, and see which hand they catch it with. You can ask them to aim their finger like they're shooting a gun at something and see if they aim right eye or left eye, right? Roll a ball, see if they kick it right leg or left leg. You can say, hey, smell this little smell with one of your nostrils and see which side they put it on, right? Hey, listen to this music, right? And see if they put it on right side or left side, right? And if we see that they're doing one right, one left, we say, okay, something's off here, right? They should either be all right or all left. So there's some kind of a disconnect in the brains there. And then the last one is persistence of primitive reflexes. So we have these primitive reflexes like, being able to grasp, right? Like you put your finger in a baby's hand and they grasp it, or you touch a baby's cheek and they turn it, right? Because they're trying to feed, right, on the breast. So these things are supposed to go away. They don't really ever go away, but they tend to fade as our neurology develops, right? And as we get higher functioning in our brain. Now, sometimes, again, as the brain, if it's not developing or gets stuck, these things will hang around, right? So we can test them, and if they do hang around, we have to slowly integrate some therapies to help get the body past that, right? And it's kind of talking about how we skip steps, right? If we go from, from crawling to running and we're skipping steps, right? Some of our primitive reflexes can get stuck, right? So we have to kind of go back. It doesn't matter if we're, 6 months old or 4 years old, we have to go back from a neurological standpoint and re-go through those pathways. Now, we don't take the same amount of time that a 6-month-old is if we were 4 or 5 years old, but we still have to travel through that pathway to develop our neurology. So right brain deficiencies are diagnosed. We usually see things like ADHD and ADD, autism and spectrum disorder, right? Asperger's, conduct disorder, OCD, oppositional defiant disorder, nonverbal learning disabilities, Tourette's. These are all right brain deficiencies. Left brain deficiencies are things like dyslexia, central auditory processing disorder, visual processing disorder, auditory processing disorder, dyspraxia, motor planning problems, learning disabilities, language disorders, reading disorders, sensory processing disorders, and dyscalculia. So conditions that are not appropriate for some type of neurological rehab or neurological advancement would be things like organic brain diseases, Down syndrome, Fragile X syndrome, right? These are genetic issues. Infection, metabolic disease injuries, physical brain injuries, right? When Norman talks about brain injuries, he's not talking about physical brain injuries, he's talking about, right, that we've had some kind of a disconnect where the brain stops developing. Strokes, brain tumors, and psychiatric illnesses. So to balance the brain, right, we touched on it. We want to develop a program based on right side, left side, and based on how many of our primitive reflexes. Now, going over to primitive reflexes a little bit advanced for this talk. Just if there is a problem, give my office a call and we can assess your child. But at home, we want to be able to stimulate, right, through movement, touch, light, sound, odor, taste, temperature, and vibration, and using gravity. Using these things over and over and over again will help stimulate the body and the brain back to a development. And it doesn't necessarily have to be a child, again, that is either on the spectrum or atypical. Even a typically functional child can benefit from neurological stimulation, right? Again, those first 6 years are so primitive to developing neurological connections that we want to try and integrate some of these things into helping our child develop. So we're going to discuss a little nutrition. Now, the nutrition section is going to be mainly based on the check protocol. Okay. For those of you that don't know it, it's a protocol based on helping children that are neurologically struggling, rebalance gut, and things like that. So before we get into that more, we want to talk a little bit about trying to maintain some kind of an order or some kind of a routine with eating, right? Typically, if we see children are skipping breakfast, that tends to have unhealthy eating habits as compared to breakfast eaters, right? The studies show that young people who skip breakfast will consume 40% more sweets throughout the day, 55% more soft drinks, 45% fewer vegetables, and 30% less fruits than people who eat breakfast. Dinner, family time dinner, research suggests a relationship between frequent family dinners and a decreased risk of children taking up things like smoking, drinking, drugs as they get older. Then regular family dinners also foster good mental health in adolescents, according to a study of more than 26,000 kids between 11 and 15. More frequent family dinners relate to fewer emotional behavior problems, greater emotional well-being, more trusting and helpful behavior towards others, and higher life satisfaction. Okay. On a poor diet is a well-researched trigger for exacerbating many of our neurological and behavioral characteristics associated with neurological developmental delay. Okay, so our gastrointestinal dysfunction and increased intestinal permeability, we call this leaky gut. The easiest way to describe leaky gut is if you had plumbing and your pipes had a lot of holes in them, that's leaky gut. Undigested foods get into the bloodstream where they're not supposed to be, and then the body starts to have a reaction to them. It has an immune function reaction to them, and we start to get things like food sensitivities, food allergies, we get increased inflammation. All these will be propagated because of our gut system. So it promotes, again, multiple food sensitivities, deficiencies, autoimmune system, and now the norm with our children because of our food supply. Studies show that children with neurological developmental delay, particularly ADHD and autism, have deficiencies in amino acids, essential fatty acids, and a variety of vitamins and minerals. This is because they just can't absorb these things, right? And it's not just kids with developmental delay. It's starting to become commonplace with all kids that our gut is, we don't have good probiotics. We're eating a lot of sugars. We're eating a lot of processed foods, a lot of omega-6 fatty acids, which is very inflammatory. And we're getting just leaky gut, which means that our bodies cannot absorb proper nutrients, and we're suffering the consequences. So there's been a review of 52 studies that examine dietary changes of the reduction of symptoms in ADHD. And they found that an elimination diet, which we'll discuss in a minute, and fish oil supplement seem to be the most promising dietary interventions for the reduction of ADHD symptoms in children. Not just ADHD, but it goes across a whole spectrum of function for children, right? Even children that we don't really notice having symptoms, right? Just as far as attention, as far as energy, as far as functionality of organs go. So the microbiome in our digestive tract, they release neuropeptides and other cell messenger substances that have a direct impact on the brain, right? A lot of your immune system is also found in the gut. So it's of primary importance to keep our gut healthy because it does have a direct impact on the brain. Also, the majority of your serotonin is released, is made in your intestines, not in your brain, but the brain uses it. So very beneficial to keep that moving. So our food sensitivities, right? More than 85% of children with neurological developmental delay have food sensitivities. Right? We produce an inflammatory response that results in more subtle mental and behavioral symptoms that could take anywhere from 6 hours to 3 days to appear. Right? That's why it becomes so difficult to identify food sensitivities. Food sensitivities are a little bit different than food allergy. Right? Food allergy is almost immediate, and we get hives, we get swelling, things like that. That can be an emergency situation. But with a food sensitivity, it's a different type of reaction. It's not an IgG, it's an IgE reaction, which is a different immune reaction. And it can take, like I just said, anywhere up to 3 days. So something that you ate 2-3 days ago can be causing some behavioral issues, can be causing some attention problems. And it's very, very difficult to associate something happened 2-3 days ago to what's going on now. We'll discuss some techniques on how to do that. So food sensitivities and leaky gut typically go hand in hand. A leaky gut causes a cascade of chemical reactions, including the release of opioids, as well as substances associated with addiction. And they can actually make a child crave the very food that they're sensitive to. Common symptoms of food sensitivities are aggressive behavior, bedwetting, chronic stuffy, itchy, and runny nose, fatigue, irritability, total meltdowns, inability to focus and concentrate, impulsive actions, headaches, including migraines, hyperactivity, learning disabilities, mental sluggishness, muscle pains and soreness in the legs, pale, swollen complexion, puffy or dark circles under the eyes, and sleep disturbances such as dreams, bad dreams, and frequently waking up. So if you're noticing any of these things, you might want to try an elimination diet, which we're going to discuss. So when we do an elimination diet, right, what we want to do is remove, these are the most common offenders that children are sensitive to, but they're not the only ones. Really, any food can cause a food sensitivity if we have leaky gut. Just means that the food's gotten into the system and the body has now built antibodies towards that food. But for the most part, we want to eliminate gluten, dairy, eggs. We remove eggs because I don't really consider eggs part of dairy, but we remove eggs because they're very mucus forming. And the mucus is not well tolerated by leaky gut. So if we want to repair the gut, we just want to eliminate eggs for a little while. Bakers and brewers yeast, okay, legumes, beans and peas, apples, tomatoes, soy, corn, citrus, junk foods, processed foods, food additives, and then GMOs, right? For those of you that don't know, GMOs are called genetically modified organisms, right? It's a whole topic in of itself. Too much to go into here, but just know that GMOs are fast becoming ingrained into everything. Most notably, soy, corn, and we find corn in most processed foods, usually within high fructose corn syrup or corn starch, right? Soy, same thing. If you want to learn more about genetically modified organisms, Jeffrey Smith has a great website. I believe it's called responsibletechnology.org. If you just do a Google search, Jeffrey Smith, GMOs, responsible technology, right? It'll pop up. I believe it's responsibletechnology.org. He maps out beautifully the dangers of it. He wrote a few books called Genetic Roulette is one. I forgot the other one is. But he'll even send you a lot of information for free on foods to stay away from, or products to stay away from that have genetically modified foods in them. They cause a lot of problems, everything from allergies to autoimmune problems to ADD, ADHD. They're really nasty stuff. Okay, so how do we do the elimination diet? Well, first thing you want to do is for the first 7 days, you want to keep a dietary journal. Don't change anything in your child's diet, but just write down everything that goes in your kid's mouth. Every food, every liquid, write it all down. Additionally, you also want to write down behaviors that shift, right? Anything like act out, tantrums, if they're having any issues with sleep, right? This way we can start to maybe recognize some patterns. Okay. After 7 days, we want to remove our suspected foods, most notably the stuff we talked about. But again, any food can be a suspect. Right? We want to keep it as clean as possible for a couple of weeks. Right? 4 weeks would be optimal. And then we're going to reintroduce one food every 3 to 4 days. Remember, we said it takes about 3 days for food, anywhere up to 3 days for a food to have a low level reaction. A food sensitivity can have a reaction. So once every 3 days, we want to introduce a food and to see if our child reacts to it. If they do, we remove that food again. All right. It doesn't have to be permanent, but it may just have to be for a while until we can reestablish proper gut function, and then slowly reintroduce one food every 3 or 4 days. So the other thing is very common is yeast infection, right? Usually that happens when child's been on 4 or more prescriptions of antibiotics within the past 10, 12 months, prolonged course of antibiotics lasting longer than 4 weeks, a continuation of symptoms after the infection is cleared, craving for sugar, persistent digestive problems, including gas, bloating, constipation, diarrhea, or you can also suspect a yeast infection. Right? So we want to avoid foods that promote the growth of yeast, such as sugars, honey, corn syrup, maple syrup, brewer's yeast. Avoid yeast-containing foods, which includes breads, dried fruits, and cheeses. The best nutritional way to restore the pH balance in the digestive system is with probiotics. Okay, either lactobacillus found in yogurt or Lactobacillus plantarum found in fermented foods, okay, like sauerkraut, kimchi, pickling stuff, things like that. And then you could also just go out and buy a probiotic at your local health food store. So onto the Nemetschek protocol, right? For helping reestablish proper gut health and proper nutrition. So when the Nemetschek protocol, he discusses a couple of issues that he sees prominent, right? And he talks about the chronic brain dysfunction in children with developmental disorders can occur through 3 different processes. And they are, number 1, unrepaired brain trauma, right? Doesn't mean physical trauma, but unrepaired brain trauma means an insult to the brain, right? A cumulative brain injury, right? And he notes that pro-inflammatory cytokines is where the brain trauma is, right? Next is a slow rate or abnormal process of neural pruning. So what neural pruning is when a child's born, they're born with probably twice as many neurons as they need. I think like 100 billion. And we need to chop that down. And we chop that down through movement, right? Through our senses. And they call neural pruning, right? So if we don't get good movement, we don't build those neural synapses and we don't develop proper pathways. Okay, and then lastly, he talks about toxic encephalopathy, which is from something called propionic acid toxicity. So there's a growing scientific evidence that the imbalance of the intestinal bacteria, right, is along with excess of inflammation within the brain are responsible for the features associated with autism, as well as ADD, ADHD, mood disorders, developmental delays in children. So regardless of whether baby's been born vaginally or cesarean, the child's intestinal bacteria will pretty much match the mother. So if the mother has what's called dysbiosis, right, a bad bacterial growth, most likely the child will have it too. So again, we talked about this just a moment ago. Children are born with approximately 100 billion neurons. Okay, we have to trim this down to about 50 billion. Okay, by the time they're 18 years old, called neural pruning. Okay, common cause of altered neural pruning is from impaired function of specialized central nervous system white blood cells known as microglia. Okay, the microglia function can be altered by leaky gut. Okay, with fragments of bacterial cell membrane that is leaked into the bloodstream and bacterial overgrowth from small intestine occurs. So the source of inflammation within pregnant women and newborn children, right, which can cause some of this problems, is bacterial overgrowth, deficiency in dietary omega-3 fatty acids, excessive dietary omega-6 fatty acids. You know, omega-3s are so important, right? Everyone's so concerned about taking B9 for neural tube defect, but omega-3s are so vitally important to developing fetus and a newborn as well, that studies have shown that if you take omega-3s while you're pregnant, can actually increase the IQ of your baby by up to 10 points, right? Which is huge, just by taking omega-3s. So let's continue. Omega-6 deficiency. Omega-6, I'm sorry, not deficiency, excess omega-6. We get omega-6 fatty acids if we're eating grain-fed beef. Right? Grass-fed beef doesn't have omega-6, but grain-fed beef is pro-inflammatory. It's called arachidonic acid. So if we can get grass-fed, that's what we should be eating. Okay? Then damage to the autonomic nervous system and the vagus inflammatory reflex. Excessive ingestion of saturated fatty acids, and excessive ingestion of processed carbohydrates, ingestion of advanced glycated end products, and first and second-hand tobacco smoke, autoimmune disorders, and probiotic use. So the core features of the Nemetschek protocol involve 2 general phases. Number 1, we want to reduce the propionic acid levels and through the reversal of the bacterial overgrowth. Now, this can be done in one of 2 ways. We can either take a prebiotic called inulin, which you can just usually find at any health food store, or if you are under doctor's care, there is a antibiotic called Reflaxmin, which you would get 550 milligrams twice a day for 10 days, and that'll do the trick as well. Reducing the pro-inflammatory cytokine production. Our intestinal tract can make chemicals and inflammation, which impair brain function and development. Right? So there are 4 targeted sources of cytokines, which are the bacterial translocation, which we call leaky gut, the abnormal activation of the microglia, right, which prevents the brain from repairing itself, deficiency intake of omega-3s, and then excess of omega-6. Now, omega-3s, we want that to be rich in DHA. There's 3 omega-3s of DHA, EPA, and alpha lipoic acid. DHA is the one that's majority used for brain function. So there was a study in Purdue University that showed that kids that are low in omega-3 essential fatty acids are significantly more likely to be hyperactive, to have learning disorders, and to display behavioral problems. Omega-3 deficiencies have also been linked to things like dyslexia, violence, depression, memory problems, weight gain, cancer, heart disease, eczema, allergies, inflammation disease, arthritis, and diabetes. So it's not just good for kids, it's good for everybody. It's called essential for a reason. Dopamine and serotonin receptors are also composed of DHA, essential fatty acid. Neural pathway development develops slow and defective without DHA. Okay, so research has shown a direct correlation between omega-3s in your diet and the number of synapse vesicles in your neurons and your ability to learn, right? So how much do we need? Well, so here's our list. You can just read it. I'm not going to list it one by one, but basically, if you're an adult, somewhere around 3,500 milligrams, and it goes down accordingly depending on age. Interestingly enough, newborns will take a lot of the omega-3s from mom. Most of the time, mom's nutrition prioritizes herself, but with omega-3s, because it's so essential to neurological development, the baby will get that first, and we'll supply it for the first couple months of life. So we want to stay away from these oils. They're all pro-inflammatory. You can see them there: soy, sunflower, corn, and all our seed oils, basically. We want to use more oils like coconut, canola, palm kernel, and we want to also use, we can use avocado oil is good as well. So the other thing that Nemetschek protocol highlights is the use of consumption of omega-9, which is an essential step, and it must be performed on a regular basis in order to ensure maximum recovery. Daily supplement with California extra virgin olive oil to reduce systemic inflammation. Now, he makes a point of using California extra virgin olive oil because according to him, a lot of extra virgin olive oil has other things in it other than extra virgin olive oil. They'll have like soy or something like that in it. And according to him, California extra virgin olive oil tends to be the cleanest, but I would imagine you could find other clean versions out there if you just did a little research. So extra virgin olive oil contains 70% oleic acid, and oleic acid not only blocks, but also reverses the underlying inflammation coming from excessive omega-6 fatty acids and palmitic acid toxicity. Several studies indicate that adults will benefit from consuming 2 tablespoons, 30 milliliters, of extra virgin olive oil daily. The daily dose of children are a little less clear according to the research, right? But you can see it there. It changes depending on age. Okay, so our preferred method to balance intestinal bacteria in children 10 years or younger is to use inulin prebiotic fiber supplement. Okay, an 1/8 to 1/4 teaspoon of inulin powder 1 to 2 times a day. The maximum inulin dose in older children is about 2 teaspoons per day. Inulin is over-the-counter prebiotic fiber that comes from a variety of natural plant sources. is derived from agave, chicory root, Jerusalem artichoke. They're all acceptable forms. So it's not a probiotic, and Nemechek makes a point of saying we do not want to introduce probiotic at this time because we're trying to get rid of the bacteria that's in the gut and repair the gut lining. Okay. Also, he discusses something the low oxygen levels in the brain may be causing a rapid rise in stress hormone called noradrenaline, right, or norepinephrine. Noradrenaline in the body is primary fight or flight hormone that comes from sympathetic branch of the autonomic system. Sympathetic is your fight or flight port. Okay. The release of this hormone may cause children to become aggressive, angry, physically violent, anxious, panicky, and overwhelmed. Okay. This noradrenaline rush may also result in some children having a temporary increase in self-stimulation and repetitive behaviors like tantrums and clinginess. Okay. Okay, sees the problem in the autonomic dysfunction patients frequently, increasing the patient's hydration and boosting their dietary intake of salt, usually like Celtic salt or Himalayan sea salt, because it has 80 to 90 minerals in it, will help with hydration and brain function. Also, we want to get movement introduced into it. So low brain oxygen symptoms and emotional outbursts may occur when the child is sitting still for a prolonged period of time, like when they're on a cell phone or watching TV, right? So we want to introduce our movement, and we want our movement to be purposeful. We want our movement to stimulate our senses. Simple ways to boost blood pressure and oxygen delivery to the brain includes allow them to move around a little bit and have their muscle contract, pushes the brain upwards against gravity. This may be done by getting them to stand up and walk around or ride a bicycle. Okay, so I'm going to stop here because this next part is very, very long. I thought I'd be able to squeeze it in, but not the case. All right, but here's what we're going to do. We are introducing a form of function corrective chiropractic, something that we're calling Mom's Tribe. And it's going to be a monthly meeting of moms to discuss child health. It's going to be free of charge. We're also going to start introducing concepts on how to teach your baby how to read, do math, right? These things are not terribly difficult to do. They just take a little bit of time. But like same thing like with the neurological stimulation, they don't require a long amount of time. They require a long amount of frequency. So it may be as much as 30 seconds to a minute tops, but 3 or 5 times a day, because a baby's their focus and their attention span is not very long. So you may get 30 seconds, but you do it 4 or 5 times, 6 times in a day. And you can actually teach a baby how to read. And we'll show you how to do that if you're part of our Mom's Tribe. All right. So I hope you guys found some value out of this. Again, when I had this in my concept, there was a lot of things I wanted to go over, but it just started to get too complicated and it started to go on many different tangents. So I tried to keep it as basic as possible. If you have any questions, drop me a note. All right. Also, please like and subscribe if you're watching this on YouTube. If you're watching on Facebook, follow my page. We're always trying to educate the public on how to live better, happier, healthier lives. And if you have any issues or any concerns with your health, give my clinic a call. We're Form and Function Corrective Chiropractic, located in Apple One Tower in Cebu City. It's right across the street from Ayala Mall. All right. So thanks for joining me, and I will see some of you next week, or next month at our next webinar. We haven't decided exactly what we're going to do yet. So if you have any suggestions, drop a note, let me know, and if enough people want it, we'll do a lecture on it. All right. Thanks for joining me, and stay healthy. Take care. Bye.